isn't it? So we want to clear it.
This meeting is being recorded.
So before that, we will just get into the program. How many of you have heard about Dr. Hewlin? Anybody has heard? Yes, few of you have heard. Jyoti has heard. Okay. So this is about Dr. Hewlin, a psychiatrist in US. He was once called upon to treat hardcore criminals who had been admitted into a mental asylum, for the very reason that they had all become very violent, not only on others, but also on their own selves. They would harm themselves. And Dr. Hewlin was called to treat them. But Dr. Hewlin, he held a PhD in psychiatry. And he said that I will not meet any of the patients personally. That was number one rule. And then he said that he will not treat them with any medication. So can you imagine a psychiatric doctor, not prescribing any medication for the inmates of that asylum? May I request you all to please put your audio on mute, please, and come on video so that, there is a little bit of an audio disturbance happening. Please mute your audio. Whenever you feel like sharing, you can unmute and speak up. So these were the two criteria which Dr. Hewlin suggested, and he asked for all the files of these inmates, these hardcore criminals. And looking at those files, as he read each and every file of those criminals, he started treating them in absentia because he did not meet any of them personally. So can you imagine somebody treating patients in absentia and without any medication? Okay, and within a span, this happened way back in 1984. You can Google Dr. Hewlin and this was the asylum at Hawaii Islands. And this happened in the year 1984. Within 1 year of his treating the inmates, he started seeing a lot of improvement in their behavior. Or else earlier, they used to be all shackled in chains, the legs were chained, they were all handcuffed. And the doctors and the nurses in that particular hospital, they used to keep their backs against the wall, when these inmates were walking in the corridors with their chained shackles, for fear of being hit by these inmates. So such was the scenario in that hospital. So then what happened? Slowly, he started seeing the improvement. And within 1 year, all the inmates of that asylum, they had completely changed from their negative behavior to positive behavior, by virtue of which that entire ward of that particular hospital where these hardcore criminals were put up, it was closed completely. The inmates were released and they started leading normal lives. Can you ever imagine this happening? So what did Dr. Hewlin do? All of us are interested to know, because I was also very much interested to know, how did he treat the inmates who were violent criminals, hardcore criminals? How could he treat them in absentia without any medication? So this is called, this method I will tell you now in a very short while. And that is about Dr. Hewlin. You can Google and find out. Okay, so now, and then he calls it a magical method. There is absolutely no logic to it. Are you all ready for some magic now? Yes, how many of you are ready for magic? Yes? Okay. So there are many things in our life. Do you agree that they are very simple, but yet very profound? For example, like if you take a glass of water, water is a very simple thing, isn't it? Whenever we feel thirsty, we drink water. But it is such an important ingredient of our life. Without water, we may probably not survive. A very simple one, but yet a very profound one. How many of you agree that many things in our life are very simple, yet very profound? Raise your hand. Yes, you all agree? Absolutely. Now, about this experience that I'm going to shortly give you, about what Dr. Hewlin did for the patients, inmates, how many of you want, whether you want a theoretical explanation or a logical explanation, or you want an experience? So whether you want theory or practice, raise your hand. If you want theory, you say thumbs down. If you want practical, you say thumbs up. What do you want? You want a practical, right? You want a practice session, right? You want to experience it, right? So all of you are ready for this magic to happen? Are you ready to have some tears of joy? When you finish this experience, you will end up probably having some tears of joy. So all of you are ready for that? Okay, but before that, before we get into the program, there are certain rules which we have to follow. Okay, we'll agree to the rules, all of us? Okay, so I will tell my brother to tell you the rules and you will follow as he says. Yes, over to you, Murthy.
Yeah, thanks, Gomathi. To begin with, do not open your eyes until you are asked to. Repeat loudly whatever Gomathi says. Do not suppress tears when they come, especially for men. Keep a glass of water like this always handy with you. In addition to that, keep a napkin also with you, right? Moreover, during the session, keep your video always on and the audio should be in mute. Whenever you wish to speak or anything, you can unmute your audio and speak, right? Yeah, that's it from me. Go ahead.
Okay, thank you so much, Murthy. So as mentioned by Murthy about the rules, all of you are ready for this experience right now? This is called the Ho'oponopono technique, and it is an ancient Hawaiian technique. Some of you have heard about Ho'oponopono. How many of you have heard about this technique? This tool that exists in Hawaii Islands. Okay, way back, this is almost